Thank you for joining ComForCare and At Your Side Home Care for this informative Dementia-Wise webinar, which describes medications that mimic dementia. Please let me welcome our host, Director of Special Populations, Dr. Deborah Beer.
Today we'll talk about how medications can be a problem for elders and which medications mimic dementia or make it worse. Then we'll talk about solutions and give you some extra resources. First, I want to say that dementia and Alzheimer's are terms that are often confused, and I want to straighten those out so that you understand what I'm talking about. Dementia is a group of symptoms involving cognitive impairment, and there are many types of dementia. Alzheimer's is a type of dementia. It's the most frequently diagnosed type. But all Alzheimer's is dementia, and not all dementia is Alzheimer's. This webinar is for educational purposes only. The information provided is not intended to be diagnostic or to serve as a substitute for actual medical advice. If you have concerns about your or your loved one's health or diagnosis, please seek help from a licensed medical professional. Always consult your prescriber before making any changes in your prescribed drug routine. Let's look at how medications can be a problem for elders. All older adults are highly vulnerable to drug sensitivities. This is because of their body's ability to clear drugs decreases with age. More drugs that they're on means the more likelihood that there are interactions and sensitivities. When we have someone on 5 or more prescribed drugs, this is called polypharmacy. And this is very rampant among elders. According to research reported in the Archives of Internal Medicine, nearly 60% of elder subjects in a study had their medications safely discontinued. Only about 10% needed to have medications reinstated. 88% of patients reported improved health from discontinuing medications under supervision. People with dementia are even more vulnerable than the average elder. They have side effects and interactions more easily. Certain drugs to them can be harmful, may even hasten their death. They may have negative side effects such as fall risks, disturbed sleep, and greater confusion. And this confusion can lead to more medication errors as they take medication at home. People with dementia do not need these kind of challenges, and many of them can be avoided. So how did we get here? Well, more medications are available to prescribe, and many can mimic or exacerbate dementia. Some drugs are commonly used and are better known for their potential harm to prescribers. Many are less commonly used, and prescribers don't understand their potential. Physicians may not be aware of all of the specific prescriptions and doses that their patients take. Use of multiple pharmacies by patients can result in drug interactions that slip through computerized alert systems. Let's look at medications that can mimic dementia or make it worse. Medications are prescribed to help prevent or treat symptoms. The side effects that medications bring and the interactions between them have to be balanced with the benefit of each drug. Some medications may harm cognitive function or even hasten death. Various options and personal circumstances need to be considered for each patient. Anticholinergic drugs decrease activity of the neurotransmitter acetylcholine. This includes many prescription and over-the-counter drugs. This can cause cognitive impairment or can mimic dementia or make dementia worse. The physician or pharmacist should be asked about all medications, including over-the-counter medications. Questions such as, is this anticholinergic? Or is this okay for someone with dementia to take this? Or is this medication okay for an older adult should be asked. Here are some common anticholinergic drug types, and you'll see that they span all kinds of illnesses and conditions. First, there's the antihistamines from the first generation, such as Benadryl. Anything that has a PM in it that's over the counter, like Tylenol PM, know that that's a painkiller with Benadryl added. Also included are dopamine agonists, such as for Parkinson's, some cardiovascular medications, some urogenital antispasmodics like Levsin, some anti-infective agents, certain tricyclic antidepressants, some digestive antispasmodics, such as those for irritable bowel, anti-anxiety sedatives and hypnotics, such as the benzodiazepines like Valium and Klonopin. Also, antipsychotic medications, some asthma medications, some anti-nausea medications, and epilepsy drugs. There are other drugs that can be of concern in this area that aren't anticholinergic. This includes statin drugs, narcotics, opiates, beta blockers, CNS stimulants like Adderall, non-benzodiazepine sedatives and hypnotics, gabapentin, cannabis, barbiturates, muscle relaxants, and cholinesterase inhibitors like Aricept. Yes, even Aricept, which is specifically prescribed for dementia, can cause side effects of cognitive impairment. So if your loved one is not doing well on this drug or declines on this drug, ask the doctor whether or not a trial of deprescribing could help. I need to give some special warnings about antipsychotic drugs where there's Lewy body or Parkinson's dementia. These are the people who have the most hallucinations and delusions and are most likely to be prescribed antipsychotic medications. However, some of these medications are extremely dangerous for people with Lewy body and Parkinson's dementia. The typical antipsychotics, also called typical neuroleptics or first-generation antipsychotics such as Haldol, are very dangerous for them. These medications can cause swift and permanent decline and even hasten death. Instead, neurologists who work with this population prefer atypical antipsychotics, also referred to as second-generation neuroleptics. Their preference is to use Seroquel at the lowest dose possible. According to the National Institute on Aging, Lewy body dementia accounts for 20% of dementia worldwide, so this actually affects a large population. Now, many people don't have a diagnosis of which type of dementia their loved one has, so we need to make sure that part of the process is getting a good diagnosis. There is a lot of controversy about use of antipsychotic medications for people with dementia. Often, they're used as the first step in managing difficult behavior, when actually they should be the very last resort. Antipsychotic medications are sedatives. They increase risks for falls, blood clots, infections, stroke, and death. And when they're used, they offer only modest short-term benefits, if any at all. When they're used as recommended, they're only meant to be used for 6 to 12 weeks, but often they're used much longer for people with dementia. The first thing is to get your loved one a good diagnosis to find out which type of dementia they have, and ask the physician about their opinion on the use of antipsychotics, particularly when it comes to treating Lewy body and Parkinson's dementia. Consider accepting and not medicating hallucinations and delusions. Unless the person is upset, they may not need to be medicated. Question the use of antipsychotics, particularly when they're offered as a first solution for difficult behavior. And learn and use behavioral and environmental interventions to manage their behavior instead of drugs. It's exactly what Dementia Wise is about, non-pharmaceutical best practices to manage challenging behavior. Medication safety practices will help. Which one you decide to use will depend upon what your loved one is struggling with. The use of pill boxes or dispensers can help, as can a medication reminder service. Some pharmacies will put the whole dose of all the pills into a blister package so that only one thing needs to be opened. Also, there can be reminders scheduled on the phone or in person. And as a last resort, each dose can be supervised in person. Remember, always ask the physician and the pharmacist, is this medication safe to take with dementia? We recommend a medication review every 6 months. That's where you clean out the medicine cabinets and the drawers and bring all medications over the counter and prescribed to the pharmacist for review. Any that are not going back home should be responsibly discarded. Please don't put them in the landfill or flush them down the toilet. You can lock up medications as needed, and we recommend you use behavioral and environmental interventions with or instead of drugs. Learning more about Dementia Wise will help too. A medication review should be coordinated with the primary care physician and at very least reviewed also by the pharmacist. Following the medication review, any adjustments to medications should occur only under physician orders. This can include weaning the person from certain medications or discontinuing them entirely. Follow the physician's instructions exactly and be aware of potential negative effects. The person should be monitored for negative or positive changes in health, and their symptoms should be documented. Then communicate any side effects, symptoms, and concerns that you have about the medications to your physician. Let's look at some additional resources. The Beers criteria is the standard reference of drugs that can cause harm to older people. Go to polypharmacyinitiative.com for information from the University of Kentucky Medical School. And the Polypharmacy Pocket Card is from the University of Texas Southwestern Medical Center. Are you a family member of someone with dementia, a healthcare professional, needing to manage dementia care, caregivers, or families dealing with dementia? Our offices can assist with strategies and solutions to your dementia care challenges. Contact your local ComForCare or at your side office for information about our dementia care services. If you're interested in learning more about Dementia-Wise methods, there are many features that we haven't discussed today. Look for Dementia-Wise presentations and family caregiver skill and support groups in your area. Sign up to receive free information about dementia care and other topics by visiting our website. Thank you for joining us today.